Hello everyone. So let's start with the discussion of the topic of cubital fossa. So in this diagram, I would firstly like to describe the boundaries of cubital fossa and then we will discuss the contents of cubital fossa. So let me just enlarge this diagram. Okay. So yes, when I am enlarging this diagram, you can clearly see and appreciate the boundaries. So you can see here there is an imaginary line which is made, and this imaginary line which is made here is passing through medial epicondyle and the lateral epicondyle. Okay, so here just this is the pronator teres muscle, so this would be the medial epicondyle. So here we will have the medial epicondyle and on this side we will have the lateral epicondyle. So an imaginary line which is passing through medial and lateral epicondyles of the humerus bone forms the base of the cubital fossa. Now talking about the boundaries, so you can see here, here we have got this muscle as the pronator teres muscle. So pronator teres muscle is forming the medial boundary of cubital fossa. So I am just highlighting this muscle. This is pronator teres muscle, which is forming the medial boundary of cubital fossa. And on the other side, we have got the brachioradialis muscle. So brachioradialis muscle is overlapping over the pronator teres muscle. Okay. So basically, we will see the brachioradialis muscle, which is shown along with the other extensor group of muscle. So here, this is the pronator teres muscle, PT. This here we will have the brachioradialis muscle, BR. So here brachioradialis muscle is the lateral boundary and pronator teres is the medial boundary for the cubital fossa. Brachioradialis overlap over the pronator teres muscle and this will lead to the formation of apex. This is forming the apex of cubital fossa. Here an imaginary line passing through the medial and lateral epicondyles of the humerus is forming the base. So this yellow colored depressed area which is lying on the anterior aspect of elbow joint, this area is the cubital fossa. Now, so we have done with the boundaries and the location of cubital fossa. Thereafter, I would like to show you this image where you can appreciate the contents and the floor structures. So again, you can see here we have got brachioradialis muscle forming the lateral boundary and the pronator teres muscle forming the medial boundary of cubital fossa. Base we have already discussed. In this diagram, I would like to show you the muscles forming the floor. So the floor muscle is formed by here brachialis muscle in the upper part. And this muscle is the supinator muscle which is forming the floor of cubital fossa in the lower part. Now talking about the contents, as we move from medial to lateral, we have got the medialmost structure is the median nerve. Next structure is the brachial artery. The third structure or the tendon which you are seeing, this is the tendon which you are seeing, this is the tendon of biceps brachii muscle. So this is the third structure, the tendon of biceps brachii muscle, and the fourth structure is the radial nerve. So these are the four contents of cubital fossa. So write down the contents of cubital fossa. Contents of cubital fossa. So already discussed about the boundaries, so I am not writing it once more. Contents of cubital fossa can be memorized by the mnemonic MBBR. That is the contents from medial to lateral. So the medial most contents, if I talk about the medial most contents, M stands here for medial nerve, B stands for brachial artery, another B stands for biceps tendon, and R stands for radial nerve. So these are the four contents of cubital fossa as you move from medial to lateral. The medial most content is medial nerve. Then we have got the brachial artery, the biceps tendon, and the radial nerve. Now, let's talk about the floor structures. The floor of cubital fossa is formed by two muscles. Brachialis muscle is forming the floor structure in the upper part and supinator muscle is forming the floor of the cubital fossa lower part. Actually, supinator muscle is pierced by radial nerve. Deep branch of radial nerve, that is posterior interosseous nerve, is piercing the supinator muscle. I would also like to tell you one important information that here this is the biceps tendon which is highlighted in green color. I will